Hi, this is Dr. Whiting, and one of the most popular questions or inquiries that we get here at our research institute is about osteoporosis or bone loss. The primary reason for this, I believe, is that more and more of us are entering the age where this problem becomes a greater and greater likelihood. Osteoporosis or bone loss can occur at any age. However, most often it begins to develop after the age of 50 or 55. Osteoporosis, unlike the myth, can strike both men and women. It is not exclusively a woman's problem. However, it does occur more often in women. The most common treatment for osteoporosis or bone loss would be drug therapy or pharmaceuticals. And these pharmaceuticals are oftentimes very, very effective, but they are not effective without a price. Most of these drugs have potentially serious side effects, and the longer you take these drugs, the greater the potential side effect. That group of drugs that we are concerned about today are the bisphosphonates. Long and terrible word. And you probably won't recognize any medication by that name in the first place. But you might recognize their trade names, their drug names: Fosamax, Actonel, Atelvia, and Boniva. In fact, maybe you have taken one or more a combination of these medications in an attempt to arrest and even reverse your bone loss or osteoporosis. Unfortunately, as I always advise people, short-term use of these medications may or may not be a benefit, but certainly longer-term use is to be considered and reviewed. In a very recent clinical study, it shows that these drugs have actually increased the risk of hip and other bone fractures in people who have used them for prolonged periods of time. Now, here's an interesting situation. We have a group of medications designed to strengthen the bone, increase bone density, and so on, and they're actually increasing the risk of fractures. This is so often the case with pharmaceuticals. Most drugs are like magic bullets. We view them as magic bullets, we want them to be magic bullets, and so on. But every time you have the word magic and bullet in the same phrase, you almost always should consider there'll be a price to pay for that. And I'm not talking about the price when you pick up your prescription at the drugstore. There's a longer, more insidious term problem that can be connected with almost all pharmaceutical use or abuse. Now, I'm not telling you to throw your prescription away. That's between you and your doctor. What I am going to tell you is that there is overwhelming evidence to show that there's a whole lot better way to prevent bone loss and actually even reverse bone loss, increase bone density in an all-natural way. Currently, there are at least 7 clinical studies that show that dietary supplementation can reverse and prevent bone loss without any side effects whatsoever. Remember that your bones are made up primarily of calcium and other trace minerals. So bone loss is a calcium deficiency. Now, what does that mean? That means either you are not consuming enough calcium from your diet, or you're having other issues with absorption of calcium. Calcium is a very difficult mineral for the human body to absorb. In fact, unless the calcium you ingest is acidified, either before you consume it or by the body afterwards, it is almost totally unabsorbable. For example, 1,000 milligrams of alkaline calcium carbonate, a very common form of calcium in most supplements, yields about 15 to 20% absorption unless it has other factors connected with it. So these calcium supplements, often available very inexpensively, that 1,000 milligrams will provide somewhere between 150 and 200 milligrams of calcium. Not enough to maintain biochemical function and bone density at the same time. Remember that we all lose bone on a daily basis. It's not the bone loss that should be of concern to us. It is how well and how efficiently our body can replace that bone that is lost. And just like a bank account, if you lose more than you replace, you take out more than you put in, sooner or later you're going to have a deficit. And that deficit then will result in loss of bone density and integrity. In addition to calcium, if we are primarily focusing on absorption to the bone, then we need to have a lot of other trace minerals and other nutrients present in the bloodstream at the same time as the calcium in order to ensure maximum absorption to the bone. Everyone pretty much knows about magnesium, vitamin D, boron, and so forth. But there are 4 trace minerals that I'll bet are not only not in your calcium supplement, but you may not have ever heard of them before in relationship to protecting your bone density. Those trace minerals include copper, manganese, zinc, and strontium. All the calcium formulations that we develop for our clients here at our Research Institute contain all of those trace minerals and other key supportive nutrients necessary for the proper absorption of calcium to the bone. We also pre-acidify all of our minerals through a process called chelation. And that acidification allows for greater absorption in the digestive tract. I mentioned earlier that there are at least 7 clinical studies from around the world that have shown that this form of calcium, the right form of calcium, can not only prevent further bone loss, but can actually increase or rebuild bone density as much as 4% in 24 months. That is significant. So remember, if you're concerned about your bone density, think carefully before you use such things as Fosamax, Boniva, and others. Because the drugs in that group have now been shown to increase your risk of the very factors that you took them to prevent in the first place. There is a better way, there is a natural way. Choose your calcium supplements carefully. Not all calcium supplements are the same. Some of them are absolutely worthless. They must have these trace mineral and other nutrient cofactors, and they must be acidic. If you would like referral to companies that currently provide what I call bioavailable calcium supplementation, the type of calcium that has been clinically shown to prevent and reverse your bone loss problems, please give our institute a call. Our toll-free number is 1-888-454-8464. I'm Dr. Whiting. Don't let the later years of your life be put at risk because of bone loss, fractures, breakages, and so forth. And think carefully, and remember that every time you use a pharmaceutical, there's a price to pay twice, once at the counter and once in your body. And if there's a natural alternative, which I firmly believe there is, I think you owe it to your body to pursue it, to find out more about it. You've only got one body. Make wise choices. I'm Dr. Whiting, and again, thanks for listening.